Hi, I'm Rodger Dinwiddie, and I'm the CEO of STARS. And today we're excited to announce the adoption of several programs that are expanding the services of STARS in the Middle Tennessee area. Today I have Lisa and Laura with me, we're thrilled are going to be a part of the STARS family here very soon. And we're going to talk about some of those programs that you guys have been involved with and we're looking forward to now joining hands with in the community. Lisa, tell us a little bit about the programs that you've been involved with that are going to be transitioning to STARS.
Well, one thing that we're doing that we piloted in the Nashville area already is an adolescent treatment program. And what we're calling it is YODA, standing for Youth Overcoming Drug Abuse. And our primary demographic and focus for this program are kids and teenagers and young adults ages 13 to 22 that can't afford insurance. There's a lot of people that, can pay to go somewhere or, and it's really expensive, but there's a lot of marginalized youth right here in this neighborhood, as a matter of fact, that have no resources for this. So we're hopefully providing a new resource, a new option for people that haven't had the option before.
Oh, this is really exciting, and this is a great way to expand the reach of what STARS has been about in the schools for such a long period of time, and to a great way to have this incredibly valuable resource in the community for folks who just can't afford good quality care. So we're thrilled to have that. And Lisa, there's another program that's going to be transitioning that we're excited about, and I know you are too. Talk a little bit about that one.
Absolutely. Well, it'll dovetail really well with our adolescent services, and that's called the Strengthening Families program. And with that, we're able to work with families and a young person that's in their family. And a primary component of that is to provide family education in different areas. A lot of family members don't even realize that their own drug use or alcohol use is causing risk factors for their kids and their families. They need education on that. Some parents need skills, especially the population that we work with in parenting.
Well, why don't you talk a little bit about that? Where will referrals and whatnot come from for the program?
Right. Well, as I said, it'll be anybody that is not eligible for insurance or doesn't have insurance, but the referrals for both programs will probably originate from places like the juvenile justice system, the Department of Children's Services, anywhere that you've got marginalized people and individuals that have barriers to getting services somewhere else are going to be.
The folks who would be involved in the program.
Yeah,
so
absolutely.
That's great. Well, we're excited about the two programs, and this should be a great marriage of programs and services between STARS and what is transitioning over, so we're thrilled about that.
Right. We want to do something, instead of just taking an adult program and trying to just make it fit for kids, which is what sometimes happens. This is going to be tailored specifically for adolescents and their particular challenges, whether it's developmental, self-esteem, whatever, and be able to address those in a real non-confrontational, empathetic, caring manner. It's not a program that uses confrontation at all.
Right.
That's old school.
Now, one of the really cool things about the program also is there is practice time where the kids are involved separately with the adults.
Right.
Then also there's a joint family meal time as well, where people come back together during the middle of this and spend time together working on issues that they've talked about individually. So it's a great program. Laura, we're thrilled to have your involvement here at STARS, and this is a program that we've known about for a good long time, and we're thrilled that you're going to be a part of the team here working with the deaf and hard of hearing services. So talk a little bit about that and your involvement with this, what you've been doing, and exactly who this program serves.
Okay. This program is specifically for deaf and hard of hearing children ages 6, 7 through about age 20. Basically what it is prevention, drug and alcohol prevention services, targeting basically in school with drug and alcohol prevention classes, after school programs, summer camps, weekend camps, family work. There's a big family component where I actually work individually with the families, teach them sign language, teach them how to work comfortably with their deaf and hard of hearing child, if it's behavioral or just understanding deafness or deaf culture.
And while you're going there, why is this such an important issue, substance abuse and deaf and hard of hearing? That's a fascinating issue.
Yes, for reasons such as I isolation, depression, lack of communication, lack of family dynamic and support, numerous reasons. There's a 33% higher chance of an individual who is deaf or hard of hearing becoming addicted to drugs or alcohol or dependent.
That's a really serious issue. I mean, and I doubt very seriously that the majority of the population as a whole really understands this. It's a really powerful opportunity for the deaf and hard of hearing community to really have this kind of service in the community.
And this program as well is also about getting that out into the community, so other people out there can understand. Okay, I can help with communication. I can help get my child involved or another child involved who is deaf and hard of hearing, to get them the services that they need so they can help with the prevention that they need, so long term they have a better chance.
And finally, it's really important for us to talk about some of our collaborative partners, including our funders. So Laura, who are some of your key partners in the deaf and hard of hearing services?
This program is funded through the Tennessee Prevention Network through the state.
And you've got some other partners as well who are collaborative partners as well.
This program is very collaborative with Bridges, which is the league, formerly the League for the Deaf and Hard of Hearing, Brentwood Baptist Deaf Church, Library Services for the Deaf and Hard of Hearing, and Metro Schools. Very
strong partners. And Lisa, who are some of the strong collaborative partners as well?
Well, one thing that I'm really excited about, and I know you are too, is the fact that this is really the first time that OASIS and STARS has been able to work in a collaborative effort to provide direct services to clients.
Yes, very true.
So some of our referrals will be coming from OASIS programs, in addition to the ones that we talked about earlier, like the Juvenile Justice Center, the Juvenile Drug Court, the Department of Children's Services, and our funding comes from the state, from the Department of Mental Health and Developmental Disabilities.
So we are fortunate, really thrilled to have two wonderful people who are going to be joining the STARS team soon, as well as these great program services that are going to soon be up and running as a part of STARS, that are certainly running now and will continue here under the direction of STARS. So we're thrilled to have these folks. We're glad Lisa and Laura are here, and we're thrilled that we get this kind of great opportunity. If you have more questions about this or you desire more information, you can refer to our website, which is starsnashville.org, or you can call here at 615-279-0058. Thanks.